In my brochure, the design I chose was one with darker colors and orange, to give the appearance of looking professional and serious. It has a faded background of city buildings to remind the readers and the target audience that there are many people in this world, and a good amount of individuals are also having the same problems of this global drug abuse. The brochure includes information about the global drug abuse, symptoms of withdrawals with each of the stages of the child's life, and treatment advice. Mothers who take drugs during pregnancy give birth to babies who are physically dependent on those same drugs. When the umbilical cord is cut at birth, the baby immediately starts to go cold turkey. Withdrawal from heroin or other opioids, from any addictive drug for that matter, is hard on the body. Due to an explosion in the number of infants born addicted to drugs because of their mother's use while pregnant, pediatric doctors and hospitals have been giving updated guidelines for identifying, monitoring, and treating newborns exposed to painkillers and other drugs in the womb. The American Academy of Pediatrics guidelines are a response to what the group calls an alarming increase in addicted newborns. In some areas, up to 25% of newborns are in intensive care units and are being treated for drug withdrawals. Because prescription drug abuse has increased across the nation, many of those who are addicted to opioid painkillers include pregnant women. Consequently, there has been a corresponding increase in the number of addicted newborns who experience drug withdrawal symptoms. Some babies are born addicted because their mothers are receiving pharmacy treatment for drug addiction, while other mothers are actively addicted to heroin, cocaine, or other illegal drugs. But after the pain pill abuse epidemic, most babies who exhibit drug withdrawal symptoms immediately after birth do so because their mothers are abusing or addicted to prescription painkillers. The Centers for Disease Control reports that the non-medical use of prescription opioids has reached epidemic proportions in the United States in the past 5 years. Symptoms of withdrawals for full-term babies and newborns. These include irritability, tremors, seizures, tight muscle tone, sleep problems, and shrill crying. Symptoms of withdrawals with toddlers. These include body shakes, seizures, overactive reflexes, tight muscle tone, excessive crying, slowed weight gain, breathing problems, fevers, and blotchy skin. Long-term symptoms can include birth defects, impaired growth, and behavior problems. Treatment options suggested by the guidelines can be from simply making the infant more comfortable. This can be by minimizing exposure to light and sound or swaddling and rocking. Other treatment options suggest to use medication to reduce moderate to severe withdrawal symptoms. The sooner treatment can begin, the better. The best thing for a drug-dependent baby is for its mother to spend time in the NICU, holding and cuddling her child, especially using kangaroo care. This skin-to-skin, chest-to-chest way of holding a baby has been shown to help premature infants thrive. Breastfeeding is also important, both because it promotes mother-child bonding and because it gives the baby essential nourishment, antibodies, and other nutrients. Many drug-dependent babies need more than this. We generally follow guidelines from the American Academy of Pediatrics. They recommend giving the baby the same class of the drug he or she encountered before birth, then gradually reducing the amount day by day. Morphine and methadone are the two most commonly used medications for managing the symptoms of withdrawal. If newborns do not respond to comfort support and show signs of moderate or severe withdrawal symptoms, the AAP recommends pharmacy treatment to prevent fever, weight loss, and seizures. According to the AAP, doctors have treated drug withdrawal symptoms in newborns with a variety of drug preparations, including opioids. These treatment options with the pharmacy treatment is a short-term relief of the withdrawals. However, the guidelines want to warn mothers that the pharmacy treatment cannot always be the best path to helping the baby in the long term. It can prolong the newborn's drug exposure and cause longer stays in hospitals, which in return can affect the mother and baby bond. Pharmacy treatment can also cause the mother to feel like this medication treating the child's withdrawals is the best and only solution, and leads them to be completely only dependent on the drug and relying on it too much for helping the baby's discomfort and behavior that can be hard to take care of. Mark Hudak says that the basic and main problem with medications is being able to possess the correct and perfect amount of medication to help the baby withdrawals without the chances of giving too many amounts to the point of them becoming addicted.